Good afternoon, everyone. I have that we're right at 2 o'clock. I have a few more people that looks like they're um, coming in just gradually. Uh, and I'm going to give them just another minute or two to log in. But I'll introduce myself and I'll introduce our guest speaker. My name is Penny Thomas. I am an education and outreach specialist here at Missouri Loggers, and I'm so excited to have you with us this afternoon. We're going to talk about Social Security, and we are so pleased to have David Seymour with us today. We've had David with us before, and he is so knowledgeable and delightful. He's with Social Security Administration. He's the senior public affairs specialist there, and he will answer questions that you may have. You will be muted throughout. However, to ask your questions, if you can just move your cursor over either the top or the bottom of your screen, you should come across a dialog box that says Q&A. If you want to type your questions in there or in the chat box, and we will make sure that we'll try to get to those as we go along. If you have any specific questions that David is unable to get to while we're on the live online webinar, we'll make sure that we get your email address, and we'll try to reach out to you via email if we need to do that as well. So it looks like we have quite a few people on right now. So we will go ahead and get this started. David, if you're ready, you can go ahead and take over.
Wonderful. All right. Well, I'm going to share my screen here. Just another volume check here. You can hear me okay? Everything is good in that regard?
I can hear you just fine.
All right, great. It looks like, Penny, you may have to allow screen sharing on your end. I'm getting a message now that it's disabled. So once we fix that, I think, and I get my slides up, we'll be ready to go. There we go. Okay. I'm going to share it. And I'm going to go to here. On show. Okay.
Is it working now?
I think so. Can you see my opening slide?
I don't see your
Okay.
picture yet.
Hold on just a second. Let me try.
I'm going to go ahead and make you co-host, and hopefully that'll help. I think that's what happened the last time.
Try again. Selecting share screen. I'm selecting, but it appears your slide is still showing.
Okay.
There we go.
How about now?
Let's see. This might do it here. Okay. Now you're seeing kind of like my Google Docs, right?
Yes.
Gotcha. Okay. Hallelujah. All right. There we go. We're moving in the right direction now. Okay. Now I think we're cooking with gas, as the old saying goes, right?
I think we've got it.
All right. Wonderful. Well, again, I know Penny gave you all a nice welcome when you came in, and I'm really excited to be here with you today. Again, my name is David Seymour, and of course, we're going to talk about Social Security today. And on this opening slide, you see a little bit of everybody, and that's very intentional because Social Security really does affect all of us in different ways at different stages of life. But of course, we're going to talk mostly today about retirement benefits, right? And some of the topics that go into that general category. And so you may be wondering, like, who is this guy and why is he qualified to talk to you about these things here today? Well, it's because I've been working with the agency for quite some time now. I do these kinds of events for our out of our regional office here in Kansas City, and the region covers Missouri, Iowa, Kansas, and Nebraska. And I got my start with the agency, I can't believe it's been 17 years ago now, as a claims specialist. So the very person who takes retirement, survivor, disability claims, helps people understand their eligibility and options. And so that was really kind of how I got my foot in the door with Social Security. And from there, I went on to become an operations supervisor in one of our field offices. And then the remainder of my career really has been in the public affairs and training realm. So as a training instructor, I helped train new employees all across the nation on how to be claims specialists, making sure they understand our policies and procedures and claims taking processes. So it's been a great ride. I love my job with the agency, and hopefully that joy and enthusiasm comes through today as we talk about various topics. So what are we going to talk about? Retirement benefits, of course. That's the main reason why we're here today. But we're also going to talk a little bit about survivor benefits, right? Because the reality is we do pass away, and it's important to know what our survivors may be eligible for. We'll also talk about some other things that you want to keep in mind when it comes to filing for benefits. These are some of the things that may not be first and foremost, but could play a part in determining when you want to start receiving benefits. After that, we'll kind of move on from our discussion of cash benefits, right? Meaning retirement or survivor. And we'll spend some time talking about Medicare, right? There's always lots of questions about Medicare, when to file for it, when should I file? So we'll talk about some of those details. And then we'll round out our time together today by talking about creating your My Social Security account, right? Making sure that you have access to your information and your benefit details when you need it. And at the end, we'll have some additional time for some Q&A, okay? So when we're talking about Social Security benefits, it's important to know that benefits are based on how many people are working and paying into Social Security. And so this year, about 178 million workers will pay Social Security taxes. And of those, about 94% of them will be covered or eligible under Social Security. So that's you, that's me, and many other people that we know, right? Means they will have worked enough and paid enough in the Social Security to be eligible for a benefit from it. Now, most of you know, and hopefully from other seminars that you've been a part of or other information that you gathered, that Social Security is not meant to be the only thing that you count on when you go into retirement. However, it may be a pretty big part, right, of your retirement income. And hopefully you've been learning about some of the other elements, right? Maybe other savings and investments that you have, or some type of pension or 401k plan, or maybe other income. Maybe you're going to work part-time, or you have some other type of income to rely on. Social Security is meant to be that foundational piece, right, as part of your retirement. To learn more and to become more financially educated, if you will, there is a website that the federal government has established to help the American public be more educated about various financial topics, and that's mymoney.gov. So we encourage you to kind of check that out. Some great resources on there. You're not gonna, have to buy anything or be sold anything. It's just good resources and information for the American public. So now we're really going to focus on your retirement party, right? And hopefully you're going to have some fun like the ladies are having here in this picture, okay? We'll talk about retirement, right? And so to be eligible for retirement benefits, right? You earn credits when you work and pay Social Security taxes. Most of us understand that. And to be eligible for retirement benefits, you have to work about 10 years or have at least 40 credits. And you have to be at least 62 or of age or older. Now, here in 2022, the value of a credit is $1,510. That's gross earnings. And that would be one credit. And you can always earn a maximum of 4 credits per year. So what that means is, in order to get your full credits for the year, right, especially here in 2022, you would have to have at least $6,040 in gross earnings. Of course, any earnings that you have above and beyond those base amounts is what increases your benefit amount. Now, on this slide and in some of the future slides, you're going to see links to portions of our website. You can visit those to get more details on any specific topics, right, that we're presenting on. Okay, so we always want to make sure that people have access to resources after the fact, right? Know where to go to get the information. So now that we understand how a person becomes eligible, right, for a retirement benefit, the next step is, well, how do we determine how much you'll get? That's always kind of a big question. Well, we're looking at the earnings that are posted to your Social Security record. And so it's a 3-step process. In step 1, we take all of the wages that are posted to your earnings record and we adjust them for changes in wage levels over time. What does that mean? Well, this is a process that's called indexing, right? And so what that means is we're going to take your wages from 1995, 1990, 1980, okay? And we bring them up to the value of what they are at the time that you're filing for benefits or at the time that we're providing you with an estimate of your benefits. Okay, so we're always using indexed earnings or indexed wages when we're computing your benefit amount. So after we've indexed your earnings, we find the monthly average of your 35 highest earnings years. And this is sometimes an interesting note for people because sometimes they're thinking it's your highest 3 or your highest or your last 3 years of work or things like that. That's not how Social Security calculates the benefit amount. We're looking at your 35 highest earnings years. And then the result is your average index monthly earnings. And that's the starting point by which we determine how much you could receive for retirement, how much your survivors would receive, and of course, if you would file for disability benefits, how much your disability benefit would be. Now, that basic calculation that I outlined there, right, still is very much intact. But for individuals who have worked somewhere where they did not pay into Social Security, okay, meaning Social Security taxes were not withheld, from their wages, and they are entitled to a pension from that work, okay, those individuals may be subject to what we call the windfall elimination provision, also known as WEP. So this is only for folks who have worked somewhere where they did not pay into Social Security and they are due a pension from that work. Okay, so if you know that this is may apply to you, right? What this means is that we have to take into account that non-covered pension when we're determining how much you can receive from Social Security. Okay, so the link at the bottom of this slide will take you to the portion of our website where we go into a little bit more detail about this provision. We also link to a calculator that you can use to determine if WEP would apply to your Social Security benefit. Again, this is only for folks who had worked somewhere where they did not pay into Social Security and they're due a pension from that work. So the next kind of big question is, when should I start receiving benefits, right? That's the million-dollar question, so to say. What we're going to look at here on this slide is the relationship between your age and the benefit amount that you could receive based on what age you start filing, you start your benefit. There's lots of other things that go into this big question, your health, your finances, other financial, obligations, but we're looking at age and your benefit amount on this slide. In this example, we see that we are assuming that a person has a full retirement age of 66. And if they wait until that time to start their benefit, they would receive the maximum benefit amount on their record. And in this example, we see that's $1,000, as indicated by that yellow arrow there. Now, we just learned a few slides ago that a person could file as early as age 62 for a retirement benefit. In this example, if they did that, their benefit would receive the maximum reduction, and that's 25%. So they would be eligible for a benefit of $750 if they started at age 62. But for every month that you wait to file your retirement benefit after age 62, the benefit goes up a little bit. We see that increase represented here on a yearly basis. And then you see the longer you wait, the higher your benefit could be. I know you all see some dollar amounts after age 66. And what those represent are delayed retirement credits, also known as DRCs. So you can earn those delayed retirement credits for every month after your full retirement age that you wait to start your retirement benefit. Okay, so if you delay starting your retirement benefit until after your full retirement age, you will receive delayed retirement credit. In this example, we see that those credits, we see that increase on a yearly basis. Okay, and that increase is about 8% for every year after your full retirement age that you wait. That's a pretty significant rate of return in a relatively short period of time. So you can see there could be some advantage, right, in waiting until after your full retirement age. If you're gonna wait, though, there's no advantage in waiting beyond age 70 to start your retirement benefit. That's when those delayed retirement credits max out. Okay, so as you can see here on this chart, you have some options, and what you choose to do may be different than what your spouse chooses to do, or a close one, a loved one or a relative or a friend may do. But you do have some options. Okay. We're going to take a closer look at some of those topics here. Okay. All right. So we talked in that past example there, we had a full retirement age of 66. And so from that, we know by looking at this chart that the person in that example was born sometime between 1943 and 1954. Now, if you were born after 1954, your full retirement age is going to be 66 and a few months. On this chart here, we see that increase. So I don't need any show of hands today, right, in terms of your date of birth, right? But you can see where you fall in terms of your full retirement age. And then you can also see the reduction factor that would apply to your benefit if you filed at the earliest point in time, which is age 62. Okay. Things to keep in mind, right? That your full retirement age is not the same as what maybe your parents or your grandparents were. We talked just a little bit here about benefit amounts. I know I referenced the calculator for WEP earlier in case that applies to you, but all of you have access to using our online calculators to look at life expectancy information, You can calculate, do different kind of scenarios for your retirement benefit. You know, what if I work a couple more years and make this much money? Or what if I filed at 63 and 8 months, or, you know, 65 and 10 months? You can do some of those estimates and get some more specific benefit amounts that go beyond what you would see when you look at your Social Security statement. All of our calculators are free and very easy and intuitive to use, right? So we definitely encourage you to get in there and kind of play around a bit so you can get a better understanding of your potential benefit amount. So we've kind of set the stage now for benefits for you as an individual, right? But whenever we're talking about Social Security benefits, we're always interested in anyone else who might be eligible for benefits on the record. And so when you file your application, whether you do it online, whether you do it over the phone with us, or whether you do it in person, we are going to ask if you have any minor children. That means any children who are younger than age 18 or younger than 19 is still in high school. We're also going to ask if you have any disabled children. And what we mean by that is, do you have any children who were found to be disabled before age 22? We're also going to ask if you've ever been married. And if so, are you currently married to someone? And do you have any previous marriages? Okay. And so that helps us determine, again, if anyone else might be eligible for benefits on your record. When we're talking about spouses, okay, a spouse needs to be at least age 62 or caring for a child, a minor or a disabled child, okay, to be eligible for a benefit. And a spouse, if they're filing as a divorced spouse, the divorced spouse has to be unmarried at the time that they're filing. The marriage has to have lasted at least 10 years. And the ex, meaning if they're filing on your record, okay, has to be at least 62 or receiving disability benefits. Okay, so there are some additional requirements there when we're talking about divorce spouse. So sometimes when we do this presentation, sometimes this is the first time that you know, individuals are becoming aware of a potential spouse benefit. Okay, and so I like to take some time and kind of go through what that means. So when we're talking about a spouse benefit, that means you could receive an additional benefit, okay, meaning your own retirement benefit and an additional spouse benefit based on a person that you're currently married to or were formerly married to. The most that you could get as a spouse is 50% of your spouse's unreduced benefit. On the next slide, we're going to look at a great example with some dollar amounts that's going to make this come to life a little better for you, okay? What you need to know that is anytime you file before your full retirement age, there's usually some sort of a reduction in your benefit amount, just like we were kind of looking at on the slide a few moments ago. And if you're due a spouse benefit, we're going to combine it with the benefit that you're due on your own earnings record. Whatever you get as a spouse doesn't reduce what your spouse would receive. Okay. And if you're caring for a minor or disabled child, okay, the benefit would be unreduced. Okay. And you would not be eligible for a spouse benefit until your spouse begins receiving benefits or is eligible. Okay, so let's take a look at this here. We've got a nice example here. Here in this example, a fictional example, right, is me and my husband, Joel, okay? And what we do as claim specialists when we are reviewing a claim to see if a spouse may be due benefits is we start by comparing the benefits due at full retirement age, okay, or also known as FRA, right? So we'll start by just taking a look at my record, okay? When we look at my record, shows I'm due a benefit of $1,200 at my full retirement age. So from that, we automatically know that the most that a spouse could receive on my record is $600. Now let's take a look at Joel's record. We see that if he files at his full retirement age, he would receive $400. That's the maximum due on his record. So because Joel's maximum benefit amount is less than half of mine, I'll say that one more time, because Joel's maximum benefit amount is less than half of mine, he's going to be due an additional spouse benefit off of my record. How much? Well, simple mathematics. 600 minus 400 equals 200. That would be the most that he could receive on my record as a spouse. Okay, and how would we pay that? Well, when Joel files for benefits, we'll pay him $400 or some fraction thereof if he's filing before his full retirement age. And then we'll also pay him $200 or some fraction thereof if he's filing before his full retirement age. Now, in the second example, Joel's not going to be due anything as a spouse off of my record because his maximum benefit amount of $800 is more than the maximum spouse benefit payable on my record. Okay, so we include this example in our slides, in our presentations, because one, we like for people to know about spouse benefits, but it also kind of gives you a window into the world of a claims specialist. This is the kind of information that we're looking at to evaluate, right? If a person is due additional benefits. And so in all that we've talked about to this point, everyone is alive, right? We've not talked about really survivor benefits in any detail. Well, let's kind of change our focus now and talk a little bit about survivor benefits. And on this slide, you're going to see some information that you just saw a few moments ago. Who are we interested in, right? We want to know if there are any minor or disabled adult children. We also want to know if there are any surviving spouses, whether it was a current spouse or former spouses. And this is where things vary a little bit. Now, as a surviving spouse or a widow, you could receive benefits as early as age 60. That's a full 2 years earlier than a retirement benefit on your own record. If you are, a disabled spouse, a surviving spouse, you could receive benefits as early as age 50. And then at any age, if you're caring for a minor or disabled child. So, it's important to understand, that survivor benefits could be a potential option for you and the family, depending on what occurs. And so when we kind of do a little comparison contrast here, we see the difference in age eligibility between a spouse benefit, meaning everyone is living, versus surviving spouse or widow's benefit, okay? We also see that there is different eligibility in terms of benefit amount, right? The most that a spouse could receive is 50%, but if you receive more as a surviving spouse, okay, that survivor benefit is higher than that basic spouse benefit. But of course, anytime that you file before your full retirement age, there's usually some sort of a reduction in your benefit, regardless if it is a retirement or a survivor benefit. Okay. Now, earlier when we were talking about a retirement benefit on your own record, I spoke briefly about WEP, the windfall elimination provision. That is what would apply to any retirement benefit that you would be due on your own record if you worked somewhere where you did not pay in the Social Security and you're due a pension from it. On the other side of that is government pension offset, also known as GPO. And it's a kind of a similar criteria here. If you work somewhere where you did not pay in the Social Security and you are due a pension from that work, that pension could reduce what you could receive as a spouse or a widow. Okay, and in essence, we look at 2/3 of that non-covered pension. That's what we consider when trying to determine if you're due a spouse or widow's benefit. And just like the WEP page on our website, the GPO page goes into more detail about this offset, as well as we give you a calculator that you can use to figure out if that non-covered pension would affect what you could receive from Social Security. A few other things to keep in mind when you're thinking about receiving benefits. And one of those is, do you plan to work and receive Social Security benefits? If you do, what you need to know is that there is an earnings limit that is in place until you reach your full retirement age. How much is that earnings limit? Well, for folks who are under their full retirement age, so 60, 61, 62, 63, so on, there is a lower earnings limit in place. Here in 2022, that limit is $19,560 in gross earnings. Okay, and if you make that amount or less, you're okay. There's no impact on your Social Security benefit. But if you earn over that amount, you have to pay us back $1 for every 2 that you make over that limit. Okay, so if you were going to make $21,560 in gross earnings, right? Technically, we would only be looking at, technically, I should say you'd be $2,000 over the limit, but you would only have to pay us back $1,000, right? Because of that 1 for every 2 rule. Now, in the year that you reach your full retirement age, the limit is significantly higher. And here in 2022, it's $51,960 in gross earnings. And if you make over that limit, you only have to pay us back $1 for every 3. And then once you reach your full retirement age, in that month and beyond, there's no limit. So you could go out, make whatever you want from work, and it would not reduce the amount of your Social Security benefit. Okay, and if you're kind of at that stage where you're thinking, yeah, I think I may want to work a little bit, maybe part-time or something like that, and you want to test out, if you went over the limit, so much, particularly in a particular year, you can use our online calculator to kind of take a look at the impact that that could have on your benefit. Now, when we talk about these earnings limits, sometimes there is questions about what actually counts, right? What we're looking at is any wages from employment, right? So gross wages from employment, what's being reported on a W-2, right? As your Social Security earnings, and then anything that would be considered as net earnings from self-employment, right? So if you're working as a contractor, you're filing a tax return as a self-employed person, whatever is reported on that tax return as net earnings from self-employment. So, other income from investments, capital gains, and things like that, that's not counted as earnings, right? Because you're not going out and working for those things. Now, there are some instances where you might receive a special payment. Maybe you're gonna, before you retire, there's some kind of sick or vacation pay, some type of severance or bonus that's being paid to you for work that you did before you started getting benefits. Those special payments may not count toward those earnings limits, but you would have to report those special payments to us. You have to submit proof of those to us and say, hey, this isn't a part of the earnings estimate that I provided, and ask us to consider that on your earnings record. Okay, and that link here on the slide will take you to the app portion of our website where we talk more about special payments. Another thing to think about is, will I have to pay federal taxes on my benefit? And the answer is, it depends. This is what is being considered. If you're filing a federal tax return as an individual and your combined income is at least $25,000 or more, or if you're filing a joint return and your combined income is at least $32,000 or more, you may have to pay income tax on a portion of your Social Security benefit. Okay. And so, in looking at the slide, some of you are probably like, what goes into combined income, right? That's a very valid question. This is what the IRS means by combined income. It consists of your adjusted gross income, right? So whatever you may be earning from work, right? Or whatever is kind of captured under that gross income category, plus any non-taxable interest income. So that may be from investments or dividends, some kind of, retirement payout. And then if you have started receiving Social Security benefits, only half of the amount that you receive in a calendar year would be counted towards your combined income. So this is a pretty straightforward equation, right? You can see here that if you're able to minimize or spread out your income in these areas, right, that can in turn minimize how much you may be liable for from a tax standpoint. So that may be why some people will say, I'm going to wait to start my Social Security benefits until I stop working, or me and my spouse stop working, so that we can minimize our tax liability. You may not be able to, but it's important to understand how taxation works here in this instance before you make that decision to file for benefits. And with that, I'm going to pause for a few moments here before we kind of delve deeper into Medicare and some other topics here. I just kind of want to pause and see if there might be any questions out there. I know I don't see any in the question and answer section here where you can type those in, but I'm happy to kind of pause here to see if anybody has any questions.
I don't see any out there, but I personally had a couple, if you don't mind taking a listen and seeing if you can.
Sure.
I was just kind of wondering, back on your example, and this is kind of earlier on when you were talking about the DRCs, which are the delayed retirement credits. The example that you used was somebody who was retiring at age 66. That was their full retirement age.
Mhm.
Eligibility age. And then you said that it wouldn't be to their advantage to go beyond age 70 because then they've already maxed out their DRCs.
Right.
Is that true if their eligibility age was beyond 66?
Great question. Yes, that is true. No matter what, there are no delayed retirement credits earned after age 70.
Okay.
Yeah.
Okay. And I know that you were talking about reduction in how much the spouse would receive. And it is kind of personal. I never thought that I would have a young child this late in life, but we did just adopt a a newborn a few
Oh,
months.
wow.
So,
Congratulations. Yeah.
and thank you, thank you. And it may be that I may have to look into this, but I'm looking at, um, I know that you said that you could potentially receive survivor benefits at
Mhm.
any age if caring for a child younger than 16.
Mhm. Mhm.
If something were to happen to my husband, that would be me.
Mhm.
Um, I'm assuming. What kind of reductions? Do you have any idea what kind of
Well,
reductions?
yeah. So when we talk about survivor benefits in that regard, um, I would encourage people to look at their social security statement,
Okay,
because on the social security statement it will say something like, if you pass away, we could pay the most that we could pay the family is kind of like this family maximum amount. It doesn't say the word family maximum, but it would say something like your survivors would be eligible for a total of, and it would have this family maximum amount.
okay,
Okay. So
okay,
that means
okay,
that, if in this case, right, if you look at your husband's social security statement, you could see that amount. And then the surviving children would receive up to 75% of that amount. Okay.
okay.
And then you could potentially be eligible for that as well. But of course, if you were going to continue to work, then we would take
Right.
into account any earnings that you had, just
Sure.
like I was looking at those earnings limits. Hmm.
Okay. Well, thank you so much. And we did have a few questions come in while I was asking mine too.
Good questions. Wonderful. Yeah. Hmm.
Yeah, there's one that sticks out is if I don't have 35 years of service, how is my social security calculated?
That's a great one. Yeah. So if you don't have 35 years of earnings, what we do is we add zeros for any years necessary so that when we do that computation, we are using 35 years. So let's say you only had 25 years of earnings or 30 years of earnings. We'll add zeros for however many years are needed so that when we go to do that equation, we are using 35 years. Mhm.
Okay, and we have a couple of questions that ask specifically, how does Missouri Loggers calculate into Social Security? And did you want to try to tackle that, or do you want me to say anything on that?
I'll let you lead on that and then I'll follow up based on what you share. Hmm.
Okay. Basically, I've always been told that your pension is very separate from Social Security, that it doesn't necessarily play in to Social Security.
Right. And that is, I mean, that is generally why we share that information on WEP and GPO, in our presentations with Mo Lockers. We know maybe not everyone is a part of that, so there's some a range there in terms of employment experiences and how that happens, but that's why we share that information. So if you
Yeah.
work somewhere and there are social security taxes that are not being withheld from your wages and you become eligible for a pension from that work, um, you know, that pension, okay, is going to be considered when determining how much you can receive from Social Security.
So,
So,
so as
mhm,
far as loggers is concerned, we have very, very limited number of individuals that do not pay into Social Security.
okay,
It's just very minute, the
gotcha.
numbers.
I
So
thought that that has changed over the years, right? Yeah,
yes, and they're the only ones that are eligible to have a higher multiplier in their calculations,
hmm,
a 2.5 instead of the highest being a 2%. But yeah, so unless you have a 2.5% multiplier, then you would not have to worry about Social Security being affected by loggers.
great. That's good to know. And I see David's question. Um, he's planning to receive loggers and work for the city of Springfield. And they do collect Social Security tax. What
Yeah,
effect would that have on my benefit? Yep, just kind of like Penny said, like none. I mean,
none.
what we would be looking at there, if you are if you planned if you plan to start your Social Security benefit, of course, we would be looking at any earnings that you would be making from work based on that earnings test that we looked at earlier. But as far as calculating your benefit amount, you're fine based on what Penny and I have shared here today.
Okay,
Great.
very good.
And then I see one last question where it said, can you please slide back
Yeah.
2 screens where it showed the income? I'm not quite sure. Maybe that was for under taxation here. So I'm going to try to go back to that.
Okay.
And I think that's the one. So anonymous attendee, I'm not sure if you had a particular question or you just wanted to see the slide, but there's that slide. And I'll even go back one more because I know there were some dollar amounts on that. This is also available on our website as well.
And I am going to share a PDF version of the slides, if you don't mind,
That's great.
with all of the attendees, so they will
That's
have.
great. And Penny, I'll get you an updated slide deck
Yeah,
after the meeting today.
perfect.
Because there'll be some changes to some of the
Yeah.
later slides here. Okay.
Yes, perfect.
All right. Well, not seeing any other questions here, I'm going to go ahead and move on
Okay.
to Medicare here. So if I can click right. All right. So Medicare, right? We hear a lot about it. There's always lots of talk about not only Social Security, but also Medicare. And Medicare is our nation's federal health insurance program. Okay. And so it consists of 4 parts. It started out back in 1965 with just Part A and Part B. Part A is hospital insurance. It covers you if you have a hospital stay or need to spend time in a skilled nursing facility like hospice or something like that. Part A is free for most folks who have worked and paid into Social Security. And then there's Part B, which is medical insurance, comparable to what you have through your employer, doctor's visits, specialists, routine medical care. For Part B, there is a monthly premium of $170.10. Okay. And then there are some other options. Sometimes a person may choose to enroll in a Medicare Advantage plan. That includes Part A and Part B. Sometimes the Advantage plan also includes a prescription drug plan. It also may include extra benefits like vision, hearing, dental, things like that. But even if you don't enroll in a Medicare Advantage plan, you can still enroll in a prescription drug plan, which is Part B. There are also some other options out there. There are Medigap plans, right? Things, signing up for one of those means it'll cover the portion of costs maybe that are not covered by Medicare. Right? So there's some investigation that you definitely want to do when it comes to making those Medicare choices. and I'm going to share some resources kind of here and kind of towards the end of this segment that'll help you. Medicare.gov is the website to go to for information on all of the plans, right? That is really under their umbrella. That is where you can get more details on what they cover, how they cover it, how much they cover, et cetera, and exploring your options. When it comes to getting enrolled in Medicare and determining if you're eligible for Medicare, that is what Social Security is responsible for. Okay, and so most folks become eligible for Medicare around age 65, but you could become eligible earlier than that if you're diagnosed with Lou Gehrig's disease, also known as ALS, or if you have some type of major kidney failure that requires dialysis or transplant, or if you've been entitled to disability benefits for 24 months or more. Okay, so Social Security is the one that reviews to determine if you're eligible for Medicare, and then also is responsible for processing your application. So we handle enrollment for Parts A and B, and you do have some options, okay? You can file for Medicare only and wait to get your cash benefits at a later point in time. You could also delay enrolling in Part B because you're going to continue to have Part B coverage, because you're going to continue to have employer-based coverage, okay, based on active employment. We're going to look at that in a little more detail here. Now, there are 3 enrollment periods that determine when you can file. Okay. At the top of the screen here, you see the initial enrollment period. And that is the 3 months before your 65th birthday, all the way through the 3 months after that birthday. If you don't enroll during your initial enrollment period, you have 2 other options to enroll, 2 other times. Either under the special enrollment period, which is for individuals who can show that they've had coverage, continuous coverage through an employer, okay, based on active work, not retiree status, not COBRA coverage. Okay, there has to be that relationship between current employment and current coverage. If you can show that, you can enroll in Medicare Part B after age 65 without any issue. If you're not able to show that proof, then you'd have to wait to enroll in the general enrollment period. And that happens every year from January through March. Now, we're going to look at these enrollment periods in a little more detail here in the coming slides. But one thing to keep in mind when it comes to thinking about should I enroll in Medicare? And that is if you have an HSA, also known as a health savings account. If you do, and you want to continue to make contributions to that account, the IRS says that you cannot enroll in Medicare and continue to make contributions to that HSA account. Okay, so you want to make sure that you kind of coordinate that right and make sure you understand those rules before you file for Medicare. So let's talk a little bit more about that initial enrollment period here for the remainder of 2022. Right? If you enrolled in the 3 months before you turn 65, pretty straightforward, right? Your coverage would start the month you turn 65. But if you enroll in the month after that, that is when there could be a delay as to when your coverage would begin. Okay, and you see in the last 3 rows of this chart here, you see I think the biggest issue is if you enroll in those 3 months after you reach 65. That's when there can be a 2 or 3 month delay as to when your Part B coverage would begin. So if you're filing this year and you're turning 65, between now and the end of the year, right? You want to make sure that you understand how the initial enrollment period works. Now, starting next year, there's going to be a change in the initial enrollment period. It's going to be simpler. Wonderful, right? When there's a change that comes along that's going to be simpler and better for individuals, right? Same thing applies if you apply the 3 months before you turn 65. Your coverage would be effective the month you turn 65. But if you enroll in the month after you turn 65, your coverage is effective the following month. Right? So there's no longer that 2 or 3 month delay. Okay. And again, this would only be an issue for you if you're planning to enroll during that initial enrollment period, right? Around that time that you turn 65. Now, as we look at the special enrollment period, okay, again, that's for individuals who can show that they have had maintained coverage through an employer continuously, right, from age 65 forward. Okay, they have 8 months where they can say, yep, I want to enroll in Part B without any kind of delay or penalty. Okay, but again, you have to show proof that you've had coverage based on active current employment through that employer. If you're not able to show that proof, then you'd have to wait for the general enrollment period, which is every year from January through March. For folks who enrolled this year, their coverage started July 1st. But starting next year in 2023, their coverage, if you enroll during the general enrollment period, your coverage would be effective the month after you enroll. And sometimes there's fear out there about a penalty for Medicare, like you have to pay more, right? That penalty would only apply if you're not able to show that proof of coverage like we were explaining, right? Meaning you should have signed up for Part B earlier because you lost that coverage through an employer. And if you've gone 12 months or more without having coverage, you know, as I described, then you may have to pay 10% more for each 12-month period that you went without coverage. That is where that penalty can kind of come into play there. Some other things to consider when we're thinking about Medicare. Some people think, do I actually have to do something to enroll? And in most cases, yes, you do. If you've never filed for benefits before, you do have to file an application. But if you're already receiving benefits and you turn 65, you'll automatically be enrolled. And similarly, if you've been receiving disability benefits, okay, you'll be automatically enrolled. If you're filing after age 65, your Part A coverage could be retroactive up to 6 months, but no earlier than age 65. Okay, so that's kind of important to keep in mind, especially if an HSA is involved, right? Because again, if you have a health savings account, you're not allowed to make contributions to that account and be enrolled in Medicare. If you don't have an HSA, probably not a big deal. Okay, but if you do, you want to make sure you check that out. And again, this here is a snapshot of the Medicare.gov website. I think some of the imaging has changed a bit since this slide was created, but gives you a kind of a view of what's available there and where to go when you're wanting more information on what Medicare covers and how it covers it. If you need help, and trust me, we all do, because you don't look at Medicare stuff all the time. You know, looking at insurance stuff can be challenging. There are state health insurance assistance programs, also known as SHIP, across the country that can help you with making those Medicare choices. They're not paid to lead you in any particular direction. All states are required by the federal government to provide this assistance, and their assistance is free. so we encourage you to reach out to your local SHIP counselor for assistance on making those Medicare choices. And so we'll round out our time together here by looking at a bit of our online services. This here is a snapshot of our website. Hopefully most of you have been to it before. You can access good information about benefits and what you can do with us online. But the most important kind of thing to highlight here today is your My Social Security account, which I hope all of you have taken advantage of doing and getting in there and looking at your information before today's seminar. It's a great way to get information about your benefits, do some of that benefit planning and looking at those estimates that I talked about earlier. You can do it on a laptop or on your phone. And so, the biggest advantage in having an account really is to get in there, look at those estimates, look at your Social Security statement. Are the earnings that we have for you posted, are they correct, right? Do you know how much you would get if you became disabled today, right? Looking at that information is good from that financial planning standpoint. You can also request a replacement Social Security card in some instances if you need it. And so when you log into your statement, you'll see your name in the top right-hand corner. You'll see some messages and preferences options, opportunity to print or save a copy of your statement. Maybe you need to share it with a financial advisor or somebody else that you trust. We've got a good retirement ready fact sheet based on your age range, right? Things that you need to know and be aware of. And then you can look at information about your earnings. Have you worked enough and paid enough in to be eligible for benefits and, things of that nature. Okay, so we encourage you to get in there and check that out. It's pretty easy to follow. And to open or sign into an account, of course, you visit us online, select sign in or create an account. If you already have an account, you'll select sign in and enter your username and password and your existing login.gov or ID.me credentials. If you haven't established those yet, you'll be asked to do that as part of the account process. Okay, these are just third-party sites that are used to identify your, used to verify your identity for a number of government services, not just Social Security. Okay. And so once you kind of complete that process there, you'll be able to enter your account. Now, there are some instances where people have challenges creating an account. Some of those issues might be related to a name or date of birth discrepancy. So maybe what you're entering when you're creating your account doesn't match with what's on our record. Similarly, if you enter an address in the account screens that doesn't match with what's on your driver's license or state ID. Maybe you recently moved or changed your address, right? And then if you're unable to answer some of those security or identity verification questions that are a part of the login.gov or ID.me process. Sometimes people have put some kind of a credit freeze or a block on their record. Maybe they've had some identity theft issues or something like that. And so you would need to temporarily remove those blocks in order to create your account. Once the account is created, you could go back in and establish those blocks again if need be. And so when you're ready to file for benefits, you can do it online through your personal My Social Security account. The online retirement application normally takes about 15 to 20 minutes to complete. That's usually a lot quicker than waiting on the phone and speaking to a representative to find an available appointment in your local office. But if you definitely want to go that route, you can definitely call us. We'll get you an appointment scheduled in your local office, and you can do that over the phone or by visiting the office. Okay, so you've got some options there when it comes to filing for benefits. And of course, we are still dealing with COVID-related circumstances in our offices. So we strongly encourage folks to file online whenever possible. When not, give us a call, speak with a representative. We'll do our best to take care of you to get an appointment scheduled or kind of whatever the case may be, whatever you need. And if you have to visit an office, you do need an appointment to visit an office in most circumstances. We are accepting in-person visitors, of course, and encouraging them to wear masks. Visitor capacity may be limited as well because we are still practicing some degree of physical distancing. And so, we just ask that if, unless necessary, come alone unless you require help with your visit. Shameless plug to follow us on social media. We post good information online, just might be the tidbit of information you need for yourself or for a loved one. And we got some cool videos on YouTube as well about our services and programs. And so with that, I'll kind of wrap up. I know we're just a few moments over here today, but I'm happy to take any other kinds of questions that may be out there today.
And as normal, you did a wonderful job explaining everything. Thank you so much for what
Thank
you
you,
do.
Penny.
You make it sound easy.
It is kind of, but I feel like just with anything in life, right? As long as we have, at least a little more information, right? And we kind of understand the framework, it helps make a lot of things easier. So
that's right. And so many times you don't know what you don't know. And this helps.
That is true. That is a phrase I say often, Penny. So yes, you don't know what you don't know. So
exactly.
Well,
I'm not seeing any other questions come through. So I think that you are that good.
All right. Well, I will take that. Yes. If anything comes in after the fact, Penny, please feel free to just kind of shoot it my way and I'll do my best to assist. Okay.
I will do that. And if you wouldn't mind sending me an updated slide presentation thing, and I will get that to all of our attendees to make sure everybody gets their PDF forms and be on our way and hopefully know what they're doing whenever it comes to Social Security and Medicare. Thank you so much.
You got it, Penny. Thank you so much. I'll get that to you. Bye-bye now.
Thanks. Bye, everyone.